The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi everyone. Today on Aging Horizons we have a great show planned for you. We're going to be talking about the Affordable Care Act and the open enrollment that's coming up. In fact, we're in the middle of it right now. We want you to get all the information you need if this is something that you're trying to get enrolled in. We want you to be able to make good choices and informed choices. We have a great guest with us today, so stay tuned.
I was diagnosed with diabetes in 1992 and I went into denial. It made me angry. I was a professional chef and I didn't want to change my eating style. It took me a long time to get serious about managing my health. My perspective changed from resentment to one of loving my body, the container for my spirit. Getting help from my diabetes educator supported my goals of improved self-care. I want to feel good and have a great life. My diabetes educator helps me do this.
As a Vietnam vet, returning home, nothing was easy.
Veteran Glenn Maynard and his wife Tracy.
For years, I've struggled with PTSD and related issues, including living in a camper.
Then Energy Share helped us with a deposit last year so we could get into our own place. I'm so glad we asked for help.
The only thing that got me through these times was my wife and the support of my community.
If you need help with your home energy bill, call or visit Energy Share, helping Montana families get through the winter since 1984.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Good care is your right. In Montana, there's over 11,000 beds in nursing homes and assisted living facilities. If you or a family member needs assistance or help in obtaining information about care issues and placement options, call 1-800-332-2272. If you or a family member need information about Montana's long-term care resident rights, or if you need help solving a problem or a complaint about a nursing home or an assisted living facility, call us at 800-332-2272.
Hi everyone, welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Kimmy Everman, and as I said in our open, we have a great show planned today. We're going to be talking about the currently going on enrollment period on the insurance marketplace for the Affordable Care Act. With us today is Olivia Ryuta. Olivia, it's so great to have you here. This is such a great topic. Thanks for coming.
Thanks so much for having me.
Yeah, and Olivia, you are the Outreach and Engagement Manager for the Montana Primary Care Association. Mm-hmm. And that's quite important in this whole story. So let's start with that. Who are you, who are they, and why are we here?
Sure, absolutely. So if folks haven't heard about the Montana Primary Care Association, they probably know our members. Mm-hmm. So we're an association and we have members that are the 14 community health centers across the state. So if you're in Helena here, that's Pure View. If you're in Billings, it's Riverstone Health, or in Missoula, it's Partnership Health Centers. So there's 14 health centers across the state. And then we also have 4 out of the 5 urban Indian health centers are also our members here at the Montana Primary Care Association. So we are based out of Helena and we work with our members. These are primary care clinics that are doing kind of physical health with a primary care provider. We're doing mental health and behavioral health, a bunch of work on substance use treatment. And most of them have in-house dental. A lot of them have a pharmacy.
Wow.
And so it's kind of what we call comprehensive primary care, very patient-centered.
Olivia, that's amazing. I didn't realize that there is some with the in-house dental, and I know that I hear folks needing that an awful lot.
Absolutely. It's actually really one of the things we hear from our health centers. It's really helpful when you do screening, right? We're doing screening around depression, that you're doing some of those screenings also in the dental clinic, and you're in the same building. So if somebody presents with depression or some behavioral health need, you can refer right over in the same.
So great.
Right, just walk somebody right down the hall. So it makes sense to people.
Yeah.
This model of kind of patient-centered care.
Right.
So we have, but why are we talking about the Affordable Care Act and the open enrollment period that started on November 1st? It goes to December 15th. I can't say that enough.
Okay, we'll say it several times.
So when the Affordable Care Act rolled out, and that first open enrollment period was
Which was what year? I can't remember now.
It was passed in 2010, and 2013 was the first open enrollment period. Folks will probably remember, like, the computer system broke.
Yeah,
it was a big crisis.
I do.
all these people were trying to enroll and they couldn't. I think the good news is the computer system has been fixed. Is that community health centers are working with folks who are lower income, many of whom have traditionally been uninsured. And so since the beginning, we've been involved in making sure that our patients and the communities that health centers are in are really reaching out to their patients and communities to make sure they understand what new coverage options might be available and can walk them through that application and enrollment process. Right. Insurance can be really confusing for all of us.
Yeah.
And so it's a really great service to people to be able to have someone local to talk to and ask questions of the process, and then if they run into questions as they're using their insurance throughout the year, to also have that resource available.
Absolutely. So let's do a little bit more of the Affordable Care Act 101. Were there many changes to the existing insurance rules?
Yes. So, people have lots of feelings about the Affordable Care Act. I think it's important to remind ourselves some of the things that the ACA, and I'll say ACA, right? The Affordable Care Act, some folks call it Obamacare. It changed our insurance rules, right? It changed so it did things like it guaranteed issue, right? So if you apply for insurance coverage, the only questions that you're going to get asked are where you live, how old you are, and whether or not you are a tobacco user, right? Historically, if you applied for insurance, it would be a ton of questions about all of your health and your history. So that got rid of pre-existing condition exclusions, which is huge. Everybody either has somebody in their immediate family or somebody that they know and love who has historically been impacted by pre-existing condition exclusion.
Absolutely.
And then I think as we're thinking about Montanans who are older, it changed how much we can charge the oldest folks on the insurance market versus the youngest folks. So it limited that amount. It's still 3-to-1, right? Which is a lot, but is better than it was before the ACA.
And it also, for those folks that you're talking about who are either underinsured or have not had insurance, this is an opportunity for them to step in and get the care they need.
Yeah, so historically what we know, right, is that before the ACA, people were uninsured because they couldn't afford it. Most folks weren't just like, I would like to, take a big chance that I'm not going to get hurt. People like the peace of mind that insurance provides for them.
Absolutely.
But they couldn't afford it. So there's two components around the health insurance marketplace, and that's what we call this thing, right? We call it the health insurance marketplace. Montana uses the federal marketplace, which is healthcare.gov if you're somebody who likes to use a computer. But there's also a phone option, a 1-800 number that we can make sure is available to folks. But so there's two ways, right? We know that historically people couldn't afford insurance. So how do we make it affordable, right? So we need to make it affordable. So we do that through advanced premium tax credits and cost sharing reduction. So there are two mechanisms to make insurance more affordable for folks so that they can be able to afford the insurance that they historically haven't been able to afford through the health insurance marketplace.
Well, we absolutely need to talk more about that, Olivia, because we can't stress enough that look into it. There's possibly some way that's out there to help a person who maybe cannot afford it still. I'm just so interested in how that all goes, and I'm so glad we get to talk about it today. Folks, this is a chance for people that have not had insurance before, or they have, it doesn't matter, but if you need to be insured, this is a great opportunity for you. Please stay with us. We've got a lot more to tell you about, and we want you to know everything you can.
Crackling fire, good warm. Forest fire, bad warm. Keeping the home fires burning, good warm. Watching the home burn, bad warm. Your family deserves the kind of warm that comes from being able to pay the heating bills. Whether you're a homeowner or a renter, the Low Income Energy Assistance Program may be able to help. Call today to find out if you're eligible. We can help you get comfortable with winter's high energy costs.
We've been married for 57 years, and we've always been very, very close. And Bessie fell and broke her hip, and we put her in the nursing home. And I wanted to get her out of there in the worst way, because we married for better or for worse, and we're going to stay that way. And the personal care that comes in here and gives us a hand is equally as important as I am to her. Personal care is the answer to it all, and without it, we couldn't do it.
Are you sure you can see?
Yeah.
Are the headlights on?
Yes.
Do we need chains?
No.
Need to slow down?
You know, you're probably right.
Winterize your vehicle, then winterize your mind. Stay clear of snowplows until they pull over, and it's safe to pass. Drive safely and arrive alive.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Hi everyone, welcome back to Aging Horizons. I'm your host, Kimmy Everman, and we're here today talking with Olivia Ryuta about the insurance market, or the health insurance marketplace. Olivia, again, I'm so glad you're here. Go ahead. We're going to talk about some great stuff.
Absolutely. And we're talking about it because right now is the health insurance marketplace open enrollment.
Right. Not to be confused with the Medicare open
Correct.
enrollment. And let's remind folks, Medicare enrollment, open enrollment is October 15th to December 7th.
Yes.
Okay. This is a different one.
Right. And this is the health insurance marketplace open enrollment.
Okay.
So that's November 1st to December 15th.
Gotcha.
And I think that open enrollment can be confusing, right?
Yeah,
if folks are on an employer-sponsored plan, right, they usually have an open enrollment period.
Right.
Most health insurance plans have an open enrollment period. It's the time.
You know what? And so what does that mean?
Right. Usually it means it's the time, one time each year, right, for a series of weeks.
Right.
That folks can change their plan selection. So for me, with my health insurance, I'm deciding if I want to buy the expensive dental, the affordable dental, if I'm going to, buy a vision benefit,
right.
Which plan I want to go to, kind of deciding what my health needs are for me and my family,
right.
And then what my budget looks like, and making sure that I'm buying something that I can actually afford to go. I can afford to pay the premium each month, but I can also afford to see a healthcare provider if I need to see a healthcare provider.
Exactly.
So, and in most folks, so we're talking about the health insurance marketplace, right? Mm-hmm. But most folks in Montana and across the country get their insurance through their employer, whether it's their employer directly, whether through it's a spouse or a partner or a parent, right? Because folks up to 26 can now stay on their parents' plan, so a lot of kids in college are still with their parents. So 42% of Montanans are covered through employer-sponsored coverage. The second largest group is through Medicaid. 25% of folks are covered through Medicaid. 21% are covered through Medicare, right, which is what you guys probably talk about the most on this program.
We do, often.
And then the folks who are uninsured, there's about 8.6% here in 2019 of Montanans who are uninsured. And just for some context, right, before the health insurance marketplace was available and before there was Medicaid expansion in the state, 20% of Montanans were uninsured. So 1 in 5. So we've come down a lot.
Yes, we have. That's good news.
Yeah.
That's really good to hear.
Absolutely. Because the stats are staggering, right? If something happens to you and you don't have insurance, how much you're paying out of pocket.
Well, and it can ruin your life, and you can end up losing everything. So,
absolutely.
Yeah.
So just to, I think, help remind folks that we're having open enrollment conversations, and to make sure we're differentiating between the health insurance marketplace and Medicare open enrollment.
Exactly.
And for some folks, which is I think why it's important that we're having this conversation here, we have a lot of families where somebody might be eligible for Medicare, right, and somebody else in that family might be either on the marketplace, right, purchasing a plan, or right, maybe they're Medicaid eligible. Right. That we have what we call mixed status enrollments.
Sure,
right?
so you may fit into just one of those categories.
Yeah, absolutely. So and in thinking about, in thinking about some of the ways that we see the ACA really helping folks afford that coverage, right? How did the insurance rate drop? Right. We made it more affordable. Right. So through what we call tax credits. And when people hear tax credits, it can be confusing. And so if you're thinking, well, geez, I can't afford a premium, right? Couldn't afford one now. If I have to wait till the end of the year to use my tax credit to purchase one, I'm still not going to be able to afford it, right? Right. So these are special tax credits that you get. You apply when you apply for the health insurance marketplace. You get the tax credits in the year that you're eligible for them. So if I apply today, right, for coverage starting on January 1st, I would be getting my January tax credit at the beginning of that month and not waiting for an entire year.
So you
to
have
file
the
my
actual
taxes.
cash to pay your premium each month, as opposed to waiting until you file your taxes and get your return.
And you don't even have to worry about the cash. That's all done automatically, where that portion of your tax credit is sent directly to your insurance company.
No, that's awesome.
And then if I owe a difference, right, I would write my check out each month. In addition to that.
You know, and what could be easier than that? Right. I mean, I just think that's awesome. You don't have to even worry that that's going to have to be paid every month. It's just going to go there automatically.
Right, and then at the end of the year, you file your taxes, you reconcile. If folks make, wonderful, you have a bumper year and you've made a lot more money, some folks might have to pay some of that back.
Sure.
But so when you sit down, when you do the application and when you work with somebody to do that application, it's really thinking through, what does my year look like? Do I have income that is set every month? What does that look like? How do we make sure you're applying and you're getting the tax credit you need to buy the plan that really works for you and your family?
Exactly. And obviously this is something a person could do on their own, but it's so much better if they reach out.
So I think the good news is that there are folks available across Montana who can help somebody kind of as little or as much. So if they have no idea about insurance or totally terrified about the online application, I think that that's normal. And so we have folks called certified application counselors and navigators at clinics and hospitals, tribal health departments, IHS, some community-based organizations who are ready and able to help folks understand this process and complete that application.
Right. And I guess I think what I do know about it is that these are people that are well trained and really know what they're talking about. And if they don't know, they'll find out for you. Correct?
Absolutely.
I mean, this is just something that I think people do get confused about, and it's so good that there's some place they can reach out. Well, Olivia, we have more to talk about. Folks, don't go anywhere. We need to find out more about open enrollment and just what you need to do, what you need to have, where you need to go. We have a lot more to tell you about, and we want you to stay tuned.
Suddenly, I couldn't speak.
I knew something was wrong. I called 911 immediately.
My arm didn't hurt, it just stopped working.
I knew the signs of a stroke. I called 911.
Know these warning signs, and if they happen to you or anyone with you, call 911. Treatment within 3 hours from the start of symptoms can make a difference. Stroke is a major cause of disability. It is also highly preventable. Learn the signs and act immediately. For more information, call 1-888-4STROKE.
You mean I can get help paying my prescription drug premiums?
Let me get this straight. I could be eligible for help with my family's prescription premiums even though I own my own home?
And our assets won't be counted.
If you're a Montana resident enrolled in the Medicare prescription drug program, you could be eligible for help paying your premiums. Call or visit the Big Sky RX website today to find out, even if you think you're over income.
What do you know about that? I'm eligible.
I have so many questions about power of attorney.
Well, some powers of attorney are for finances and others are for healthcare decisions.
A power of attorney designates an agent who would make decisions on your behalf.
While making a power of attorney, you have the ability to control your agent's power.
You also have the ability to decide when that POA would take effect.
Wait, am I giving away all my rights?
Power of attorney isn't a license to make any decision for you, just those that you've specified.
Your agent should be somebody that's working in your best interest, but it should also be somebody that you would trust.
What if they try to abuse their power?
Protective measures like third-party accounting, secondary signatures, defined spending and gifting limits can help protect against financial exploitation. An agent's powers can always be limited by a customized power of attorney, and they can be revoked by you or the court if the power of attorney is abused.
So carefully drafted estate planning documents can help ensure that your finances are monitored, but not abused.
If you or someone you know is being exploited, please report to Aging Services Bureau at 844-277-9300 or the Legal Service Developer at 1-800-332-2272. This message sponsored by the DPHHS Aging Service Bureau.
Hi folks, welcome back to Aging Horizons. We're here with Olivia Ryuta. Olivia, when we left our last segment, we were talking about tax credits for folks in the health insurance market. Where does Montana stand with that?
So we have about more than 42,000 Montanans who get their health insurance through the marketplace. Of those, 87%, the vast majority of them actually qualify and receive that tax credit. And so if someone's thinking, yeah, health insurance premiums are expensive, right? They are.
Right.
But for many Montanans, the majority enrolled in the marketplace are getting that tax credit so that each month the amount that they're paying is lower and ideally more affordable so that they can really...
And I just think that's brilliant to give folks the opportunity to have that on a monthly basis and not make them wait for it to come at the end of the year. I just think that's great. So what about, let's kind of shift gears a tiny bit, Olivia, because I'm really interested in this. What about Medicaid expansion? Because that really comes into this conversation.
So, and to remind folks, Medicaid expansion was part of the Affordable Care Act, right? So we didn't expand Medicaid right away in Montana. We had a bunch of different conversations at the state legislature. Passed in 2015. Our Medicaid expansion started in 2016. We recently, this past year in 2019, had another conversation about Medicaid expansion. But there are about 90,000 Montanans who are enrolled in Medicaid expansion. Of that 90,000, 23%, so almost a quarter, are folks between the age of 50 and 64.
Wow.
Right, so it's been a really important, kind of coverage, way to access coverage for folks who historically, right, may have been uninsured, right? They're just trying not to get sick until they're eligible for Medicare. Or, you know, we heard stories of, you know, people taking classes so that they can access student insurance and all kinds of different ways that people were trying to make ends meet to get their insurance coverage. So Medicaid is huge for older Montanans.
Absolutely, and I think it's just really important to remember that Medicaid expansion is for even more folks. I mean, you can make a little bit more, right, to be still eligible?
Yeah, so for a single person Medicaid expansion eligibility, you can make up to $17,236, right? So for a family of two, that's just over $23,000. So there's a lot of folks who are working, right, and who are still eligible for Medicaid expansion.
Exactly.
So we're in Marketplace open enrollment, and right now is the time to enroll in a Marketplace plan. If somebody's eligible for Medicaid, you can do that at any point throughout the year.
Okay.
But during open enrollment, what we, you know, even if somebody's in a plan, and you know they got a letter from their insurer that says, great, you can do nothing and stay in this plan, we encourage everybody every year to reapply.
Absolutely.
Because the plans change.
Yep, absolutely.
The plans that are offered by the insurers change, and what we know is that when people shop around, they save money. Right. And there are a lot of different plan options out there.
Right.
Also, for this open enrollment period, what's exciting is that because of a bill that passed in the legislative session, we're seeing premiums also go down.
That's great.
And so
That is good
even
news.
if somebody, maybe they had coverage, then they weren't able to afford it. I think for this plan year especially, everybody should go back to the health insurance marketplace, reapply, and see what they qualify for.
And that's a great segue. How do we do that? What do we need to do?
So there's a couple different ways to apply. I think most folks like to sit down with somebody, right? So so there are enrollment assisters in Montana who can sit down with you and walk you through that application. So you can sit down with somebody in your community, right? If you don't want to travel or there isn't somebody in your community, you can either call the health insurance marketplace, or you can go online if you're somebody who likes to do your shopping online at healthcare.gov. And it's just one application for everybody in your household. You submit the application, you put all your information in, you hit submit, and it tells you instantly what you're eligible for. And then you can go shopping with whatever tax credit you might be eligible for right then and there.
Because you're going to know what you're going to be able to afford by doing that exercise,
absolutely.
right? I just think that sounds great. And the website didn't work, but it's been a few years and it's really come a long way.
It is a fast, pretty clean process for somebody to do that. And so, and if somebody has a relationship with their insurance agent or broker, absolutely they can go to them as well. But so I think there's lots of options for folks who have questions and just need a little bit or a lot of help going through that process.
Right. And the navigators and the assisters, pretty highly trained folks.
Yeah, so many of these folks have been doing this for many years, right? They care deeply about the folks in their community and spend a lot of time making sure that if I'm applying for a plan, it includes my providers, it includes my prescription drugs. I can afford that monthly premium. I can afford to take my kid in if they get sick, right? That it's not prohibitive to see a primary care provider, for example. So it's helping somebody through an application, but really having a conversation about how insurance works and kind of to have more tools to make it really work as best as it can for every Montanan and every family.
So, okay, Olivia, this has been a great conversation. We have 1 minute. Let's talk about enrollment periods yet again.
Yes.
We don't want people to be confused.
So right now we are in both the Marketplace and Medicare open enrollment. So starting with Medicare, between now and December 17th, folks who are Medicare enrollees need to choose their
December
plan.
7th.
December 7th. Sorry, December 7th. And then for the Marketplace, between now and December 15th, you need to apply and select a plan. Both of that coverages, they'll all start on January 1st, 2020. So we're shopping for January 1st.
Right. Reach out, get some assistance. Don't have to do it blind or without, all on your own. There's plenty of people out there to help. We're going to put some stuff up on the screen so folks know exactly where they can reach out.
Absolutely.
Olivia, this has just been a great, great show. I'm so glad you were with us today. Everyone, please, if you think that you're not eligible, just take a look. You might be surprised. For Aging Horizons, I'm Kimmy Everman. Thanks for being with us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.